Welcome to NU 501 Advanced Nursing Roles, Seminar 2. For this seminar, we will be covering essentials to nursing and Essentials of Nursing by American Association of Colleges of Nursing, AACN, exploring underpinning of ethics, differentiating between MSN and DNP prepared advanced practice nursing roles, evaluating classifications of competencies of practice for health professionals, discussing future practice educational requirements, and evaluating essentials of competencies for advanced practice roles. Key terms for this unit are the AACN Essentials. These elements defined and provide a framework for nursing education by outlining expected professional behaviors and skills specific to generalist and advanced practice roles. The clinical prevention, health promotion, and disease prevention activities. Competency-based education to progress students from novice to expert, where they must meet objective defined performance-based ratings or standards because the focus is demonstrated on content and skill mastery, competency-based education, independent time, centered traditional teaching methods, and student progress that is demonstrated by content mastery. Educational competencies. These are observable indicators of knowledge, skills, and attitudes which can be measured. Health determinants. You'll be measured by personal, social, economic, and environmental factors that determine the health status of an individual. So you're going to be looking at different populations. Healthy People 2030 is a national initiative that targets clinical prevention and health activities to improve the health and status of the United States citizens. Leading health indicators. This targets the 2030 Healthy People design to help achieve those goals. Population-based health, an approach that treats the population as a whole or as a patient care and services that are responsive to unique cultural, ethnic, socioeconomic, emotional, and spiritual needs. Activities for risk management are processes of policy used to reduce liability, exposure, and improve quality of patient care throughout healthcare institutions. Okay, the AACN on this slide and the core competencies or essential competencies are noted here. These links will provide you access to core materials. What's the difference between an MSN prepared advanced role and a DNP advanced role? The MSN is a clinical preventative and population health competency. It is broad with determinants of health, genetics, epidemiology data, and we deliver culturally relevant prevention and strategies to communities. It's evaluated for its effectiveness for interventions that affect population-based health. The design and delivery of care is standardized, advanced, equitable, and efficient preventative services, and health policies are also at the core of the MSN Essentials. The DNP essential is a clinical prevention of population health that improves national health competencies. The synthesis of related materials, clinical versus population health, psychosocial, dimensional cultural diversity, and development, implementing and evaluating interventions to address, improve, and promote access to health gaps for individuals and aggregates, also populations or communities. Nurse educators, we're going to talk about them first. These practice standards are professional development and curriculum design. So either the nurse educator will practice in an academic setting or in acute care or long-term care or any other clinical setting. There are 8 core NLN competencies that guide the essentials for the nurse educator. It also guides their teaching methodologies and assessment strategies. Core competencies for the nurse educator are facilitating learning by creating environments and strategies conducive to student learning, facilitate learner development and socialization while helping students develop both professionally and socially. Nurse educators use assessment and evaluation strategies, implementing effective methods to measure and improve student performance. Participants in curriculum design and evaluation. The nurse educator contributes to program development and outcomes assessment. They function as change agents and leaders in driving innovation within nursing education. The nurse educator pursues continuous quality improvement, consistently enhancing teaching practices. The nurse educator engages in scholarship, participating in research and scholarly activities such as journals and articles. They function as or within the educational environment, operating effectively within institutional contexts. The executive leader or nurse administrator typically starts at the MSN level. The nurse leader applies skills and decision making and provisions of high quality nursing care, team coordination, and oversight of care delivery. At the DNP level, the nurse leader ensures accountability for quality health care, use advanced communication skills and process to lead initiatives in healthcare systems. All nurse leaders are responsible for environments that value diversity and cultural competency. They ensure patient welfare through evidence-based policy. The picture on the slide shows systems thinking and visionary thinking. They are 2 different types of process that can be implemented within healthcare systems to streamline professionality, communication and relationships, knowledge of the healthcare environment, and business skills and principles. The nurse practitioner, we're going to start at the bottom of this scale, starts with the basic of a health assessment and health status of their clients. They diagnose, create care plans, implement those care plans, and do follow-up. All nurse practitioners have interpersonal collaboration with their communities, their providers, and other resources available to them. They will also need continuing education. The AANP on the slide is a link, so if you check it out, if you want to, it is an organization that will help you and guide you through your nurse practitioner role. The State of Nursing Practice Acts. What do they do? What do they control? And why do we need to understand them? The Nurse Practice Acts control the legal and ethical practice of nursing. They set our scope of practice, our licensure requirements, establish educational standards for nursing programs, and outline conditions for disciplinary action that protect the public and ensure nurses are competent and accountable for professional conduct. Collaborative practice is when a nurse practitioner is having to be supervised by an agreeing physician. So in the state of Florida, we have full practice privileges, and nurse practitioners have the ability to open their own clinics and subsidiaries to practice. Some states in the United States do not allow nurse practitioners to have full practice privileges. What is full practice authority? It's the ability to provide care without a mandated supervisor. In a state that is granted independent practice, a nurse practitioner can assess, diagnose, and treat a patient in the same way the physicians do. The State Board of Nursing regulates the nurse practitioner or any nursing role. They usually include a mix of registered nurses, licensed practical vocational nurses, advanced practice registered nurses, and a consumer. Someone that is not within a healthcare role will be on the State Board of Nursing to evaluate and create equity among the group. The board structure decisions are decision-making powers and authorities which are uniquely for each state and each board. They have a model of licensure, so each state, a single state, has its own model. They have a nurse licensure compact throughout the United States, so if you have a compact license, you can work outside the state you're originally licensed in if the state correlates with the other intended state that you want to work in. They have enhanced nursing licensure compacts, which was implemented in 2018 in order to work in all 50 states. Legal implications for your state are know your state's regulations for your nursing practice, whether it be in leadership, a nurse practitioner role, or an educator role. You need to know your scope and what you have the ability to do. This will help you mitigate any risk or liability, meaning any treatment or falsification of any kind of care that you may provide. And then you want to also know how the billing is completed within your specific area, so specific state. So for the upcoming modules, you want to make sure that you review the discussion and the assignment well. Look at the rubric to make sure that you do not miss asking a question to your peer or just creating an excess of new knowledge. So create some new knowledge for the person to respond to, and the assignment is the paper. Thank you for listening. If you have any questions, please send them out to me. Remember to post your general questions in the virtual office so all that can see. If they need to be handled out of Community Eye, please send me an email specifically at any time. Thank you.